So I wanted to talk about the new bills in the House and Senate with telehealth expansions. Are you in favor of making these expansions permanent?
We are absolutely supportive of efforts to give us the authority to be able to utilize telehealth in greater ways. We want to make sure that we don't leave anyone behind, as I said before, so that telehealth should be available to all Americans universally. And we want to make sure that that includes, of course, making sure broadband is and quality broadband is out there for all communities, whether it's a rural part of the country or an inner city poor area of the country. And we want to make sure that there's accountability. When these services are used, we want to make sure that Americans are getting a valuable service. We want to make sure that these providers are providing a service that might not have been available had we not had telehealth, but that it also results in better quality services and treatment because we don't want to be billed for things that don't result in better health for Americans.
Yes, just to follow up on that issue of equity, you mentioned broadband. For all the advantages of telehealth, it does require the ability to have a smartphone and coverage. Do you see it could actually exacerbate inequity going ahead, or do you see it as curing those problems?
Well, not under my watch. We're not going to do things that increase disparities. We're going to do everything we can to include everyone. It should make no difference what zip code you live in America. You should have access to whatever technologies we as a government through our taxpayer dollars make available. And so that's why we want to make sure we do this the right way and that there's accountability on both ends of the system. And by the way, when we talk about this new type of healthcare, it could be visual or could be audio. There are circumstances in which you don't need to have a smartphone. A phone, any kind of phone might be enough. We just want to make sure that we're taking advantage of all the technology that lets us communicate with each other to make sure that we're also providing healthcare where possible.
So I wanted to raise an issue that we talked with Dr. Resnick about earlier on, and that's licensure across states for telehealth. During the pandemic, there was some relaxation. There's a compact that allows some, and there are some state agreements. What's your position on this? Do you believe that we should have the ability for doctors to work outside their states?
That's again the accountability issue. If we're the farther away you go from the direct connection between patient and provider, the more difficult it will be to try to provide for the accountability quickly and fairly for the patient. And so if your doctor is 30 miles away and you live in rural America, we can track down that doctor 30 miles away from you. But if your doctor was 3,000 miles away from you, that's a tougher sell for a consumer who's now trying to get accountability for a service that wasn't properly provided.